Please.
So Jane Shen's from Suzhou University in China. She's spoken in this forum before with presented fantastic results with congenital hand surgery. And this is another novel technique for first web space reconstruction. And I've had the privilege of seeing some of her, Francisco's shared me some of the results already, and they're very impressive. So I'm really looking forward to this. So thanks very much, Jane.
Thank you, Soda. Thank you, PULM Talks. So I'm Xiaohuang. My English name is Jen. I'm from Suzhou University Children's Hospital, and today's my talk about the pedicle flap from the dorsal wrist for first web space reconstruction and anatomical consideration. And this is an anatomy. Two artery systems supply the dorsal continuous area of the wrist, and the dorsal branches of the radial and ulnar arteries, which accompany the corresponding continuous nerves supply the radial and ulnar aspects. These systems consisted of continuous perforators coming through the extensor retinaculum and those arising from the artery branches along with the dorsal continuous nerves. And these photos by Dr. Wenlong Zhang, he's my friend, and this picture shows the dorsal branch of the radial artery. Round bleeds the abductor pollicis longus and extensor pollicis brevis tendons at the styloid process of the radius, crossed dorsally and then continued to the deep palmar arch through the first and second intermetacarpal space. This is radial arteries, and this is perforators, and this is nerves, radial superficial nerves. And then this picture photos was photo by Wenlong Zhang, and skin perforators from radial artery branches around the radial nerves often caused obliquely, and then perforators that arose through the extensor retinaculum spread like a book over the extensor retinaculum. So this perforators is like a book is very beautiful the pictures. And I introduced two cases. The two cases was did 8 years ago. I did this is the first case. The radial artery perforate flap can be designed around the axis of the radius, rotating 118 degrees to cover the first wave. However, the donor site needs skin grafting, resulting in scars that affect the appearance. And this is another adult female patient. The soft tissue defect of the first wave was repaired by a radial artery perforate flap. The perforating branch of the skin flap is accompanied by the superficial branch of the radial nerve to provide blood supply. And so today we talk about another flap design. And the radial artery perforate flap based on the tapetia anatomica can be designed transversely at the dorsum of the wrist to facilitate primary cross. And this anatomical picture was photo by Dr. Soda. Thank you. And I introduced 4 patients. This is the patient 1. 1 year old ago, type 3A some hyperplasia. And the first procedure was FDA's transposition to reconstruct some upside function, radial artery perforator flap to reconstruct the first wave. And this is flap and to reconstruct the first wave. In children, the skin at the wrist dorsum is loose. The donor side of radial artery perforator flap can often be closed directly. Hence, this flap is good for widening the first wave. And the second patient is a 2 years old girl, type 3A some hyperplasia. And also, like the first one, FDA's transposition to reconstruct some upside function, radial artery perforator flap to reconstruct the first wave. And pay attention to the plan of dissection of the dorsal flap to protect the veins. Picture 3, we can see the veins was protected. And this is a patient 3. Is a 17 months old boy, type 7, some radial trajectory with a narrow first wave. The first wave reconstructed with radial artery perforator flap procedure, and some way amplitude the radial trajectory and widens the first wave. Designs the dorsal wrist flap, and schematic diagram showing the perforating branch of the dorsal wrist of the radial artery. And the first picture can see the artery. So we use the schematic diagram showing the flap with 2.5 centimeters. After follow-up, we can see no flap necrosis. The patient 4 is a 15 months old boy, radial trajectory combined some hyperplasia and first wave narrow. Both of some is too small, and the first procedure is I did the some on top plastic, and then designs the radial pedicle flap from the dorsal wrist for first wave space. The flap with 3.0 centimeter. We preserve the neurovascular band and perform on top plastic procedure to reconstruction some. The arrow shows the point of the perforated radial artery. After the surgery, the radial skin of the flap is incised for easy rotation, and the dorsal donor side can be sutured directly. After surgery, the right picture shows 4 months follow-up. We can see is his dorsal wrist scar is okay, and the first wave is enough. Is enough that the reconstruction the some function. The plan of dissection of the flaps are all superficial to the main dorsal vein at the dorsum of the wrist, up to the perforator outlet of the tapetia and the tentacle, up to EPL tendon. We have performed more than 10 cases of transverse radial artery perforator flap No case of flap necrosis. The flap width is from 1.0 centimeter to 3.0 centimeter. Conclusion. Transverse radial artery perforator flap is suitable for children's the first wave reconstruction, because the children's the wrist of the dorsal of wrist donor side can be sutured directly. The plane of dissection shall be in the superficial facial layer, because we should protect the vein, the dorsal vein. The point of rotation is the point where the propelled blood vessel exits the tibia and tamica. It's the perforate. Thank you, everyone. This is my team, hand surgery department, Children's Hospital of Suzhou University. We focus on congenital hand. Thank you.
Thank you.
Thank you, Jane. That was fantastic. On your pictures and the cases you demonstrated, the length of the flap seemed to be limited to the ulnar side of the wrist. What's the maximum length that you can take?
Jane, is Liu Bo there? Bo Liu is there?
Dr. Bo Liu is
Is Dr. Lowe there?
Sorry, can you repeat the question?
The one question, Jane, was how long can you take the flap?
How long?
The length of the length, not the width. We think is 3 centimeters, but how long?
I can it's upon the first wave, but narrow or wide or width, and because from the why. Unmute. Sorry, that can you unmute the Dr. Bolios? He can't communicate. He can't.
We might have to unmute everybody, Jessica.
Dr. Liu Bo, Dr. Bolio.
Bo Liu. Ah, yeah. Okay.
You see?
He's unmuted now.
Yep.
And the surgery is I only 2 hours. I can do finish it as from the some reconstruction and finishes a flap and maybe 2 hours.
The extent of the flap seems to get to here. Can you bring it around to the front, to the palm?
Yes, I can. The flap is enough to reconstruct the palm of the web.
Okay. And another question was, do you use Doppler to find the perforator, or do you just rely upon dissecting from lateral to, or from ulnar to radial and seeing the perforator?
No, I didn't use the Doppler to, I didn't use the Doppler.
You just know where it is?
Yes.
Okay. Do we have any other questions? I think that's sort of covered most of what's on the, it's a beautiful flap. I wondered, in the long term, do the children have problems with wrist flexion? Is the donor site closure tight, and does it limit wrist flexion?
Wrist flexion. So I did this children. So after surgeries, I can told them to sprint in one. It's the first month after surgeries. I suggest patients to use sprinting, and then after one month later, I will suggest the children to exercise, and then no one have the wrist motions functions have some infected motion. So like the best with cases, like the best case like this, the width is 5.0 is so big dorsal wrist flap, and this baby is also not wrist functions questions.
So Dr. Cozen was asking about the plane of dissection. I take it you stay just superficial to the dorsal veins, the main dorsal veins on the hand, and you're in that subdermal plane between the flap is very thin. You're leaving the dorsal veins intact, and you're in that, just in that subcutaneous plane above that, correct?
Yes.
他就说你的这个解剖平面是否是就在静脉的浅层，是不是就浅于静脉？
是这样的，就是从背侧刚开始这边显露的话是静脉，但是到穿刺出来的地方是会渐深，就是这个层次是逐渐的，就是不是穿刺的地方肯定是会层次会深一点。
Okay. So sorry. So I just try to explain what Dr. Shen do for you. So for the tip of the flap, we mean the most ulnar side of the flap is quite superficial to the veins, as you can see here. But gradually to the pedicle, the plane is a little deeper, so that we have a thicker pedicle area that and she usually find the location of the perforator, so which is a secure of the
and the EPL tendon is the landmark of where you go deeper.
Yeah, 他就问你是一般开始变厚一点，你的这个从哪儿就开始变厚
啊？在跨过这个桡神经前肢这块区域，就是桡神经前肢我是要保护好的，就是桡神经前肢这块地方跨过就变厚。
Yeah, so when you dissect beyond the superficial radial nerve, then she will go deeper.
Okay, and is this what indication is there for this flap rather than a 4-flap Z-plasty or a transposition flap from a simpler option? Where is her indication for this more extensive flap?
他就问你，就是说这个皮瓣的手术指针是哪些？因为我们也可以做一些类似成型啊，其他一些简单的操作。这个皮瓣什么时候会用这个皮瓣？
对， 我觉得虎口开大是我们日常做的工作里面非常多的啊，就是 Z 字成型4磅、5磅，或者是做一个
对，这个皮瓣的手术指针是什么？
对，所以这个皮瓣手术指针就是我要足够的松解，就是足够松解到什么程度呢？就是，它有到，其实这一类的病人啊，就是像拇指发育不良的病人，其实是很好的一个适应症，因为我们的这个掌骨间的那个这个筋膜要完全松解的嘛。如果单纯的虎口开大只是皮肤的松解，可以做 Z 字瓣，但是我们要松解到整个到纵向的，一直到掌骨间，把第一掌骨往外面拉的时候，把第一掌骨往外面松解的时候，这样子的一个结构就可以很适合用这样的一个皮瓣。然后就像我们做多指，就是多指的类型，也是希望把第一掌骨跟第二掌骨有这个掌骨间的一个扩大，用这个皮瓣
缺损的比较多呗，是吧？
对，缺损比较多，对。
So the indication is for the patients, for the children that require large defect which cannot be covered by the simple Z-plasty, particularly for the cases like very narrow web space when the first and second metatarsal is so close. After reconstruction, you need to set the two metacarpal apart. There will be a large defect which cannot be covered by simple Z-plasty or some small flap. So in this case, she would like to use this kind of flap. Yeah.
That's great. I think we've covered most of the questions on the chat. Has anybody got any other questions for Dr. Shen? Everybody will be doing radial artery perforator flaps from tomorrow. Okay, I think that's great. Thank you very much, Dr. Liu. Thanks very much, Dr. Shen, for your paper. That's fantastic. Zesko, do you want to take over?
Yeah, thank you very much. Thank you for your talk, Dr. Shen. Wonderful. So see you in 4 weeks. Not in 4 weeks. The second Sunday or every month at 1 p.m. GM2+2 time. Barcelona time. Thank you, everybody.
Thank you.
Good night.
Adios.
Thank you.
Adios. Thanks, everyone.